Welcome to The Explainer. So today, we're going to tackle a really important challenge in healthcare, how to safely and compassionately give medication to children. Believe me, it's about so much more than just the medicine itself. It's about building trust right from the very beginning.
You know, it's a question you hear a lot, and it might seem simple, but thinking of children as just small adults is a huge misconception. The truth is, a child's body is literally a work in progress. Think about it. Their liver and kidneys, the body's main processing plants for any medication, they're still developing. This means they handle drugs in completely different ways, turning what seems like a simple task into a really delicate balancing act.
So, here's our game plan. First, we're going to dive into the core philosophy that should really guide every single interaction. Then, we'll walk through the absolute must-do safety checks. After that, we'll get creative with different ways to give medication. And yeah, we're even going to tackle the big one, needles. And finally, we'll bring it all together with the most important principle of all.
Okay, so everything we do in pediatric care, every single action, should be guided by one really powerful philosophy. It's called atraumatic care. And honestly, it changes everything.
Think of this as our North Star. It's a fundamental commitment to minimizing distress, not just the physical kind, but the psychological kind too. This idea completely transforms our focus. We stop just thinking about getting a task done and start thinking about protecting a child's emotional well-being and building real, lasting trust with them and their family.
All right, so with that philosophy as our guide, let's talk about the non-negotiables. Before any medication even gets close to a child, there's a safety process that is the absolute bedrock of everything we do.
This process basically builds a fortress of safety around the child. You start by assessing the whole patient, not just their illness. What are their allergies? What's their developmental stage? Then comes the super careful dosage calculation, which is so critical in pediatrics. And for any high-risk medications, that double check with another nurse, that's your safety net. And finally, the last line of defense, confirming you have the right patient every single time. There are no shortcuts here, absolutely none.
Okay, so we've got our safety protocols down. Now let's move into the art of administration. This is where clinical skill really meets creativity. The goal here is to find the path of least resistance and greatest comfort, which, for kids, almost always starts with giving medicine orally.
It is incredible how tiny adjustments can make a world of difference here. For instance, instead of squirting medicine straight back and triggering a gag reflex, you aim an oral syringe to the side of the mouth. Total game changer. For an infant, you can use a nipple and let them do what comes naturally. Just suck the medicine down. And hey, never forget the power of positive reinforcement. A simple sticker can completely reframe the entire experience for them.
Now check this out. This is a perfect example of how a child's anatomy directly changes our technique. In little ones, kids under 3, their ear canal is shorter and it curves downward. So you gently pull their earlobe, the pinna, down and back to straighten it out. But for older kids, that canal has matured and it curves upward. So for them, you pull the pinna up and back. It's a tiny detail that makes a huge difference in actually getting the medicine where it needs to go.
These are just such smart, compassionate little tricks, aren't they? The eye drop one for a toddler who's clenching their eyes shut is brilliant. You just work with them, not against them. And warming up eardrops, that prevents that startling, uncomfortable cold sensation. See, these aren't just clever hacks. This is traumatic care in action, always putting the child's comfort first.
All right, let's talk about the elephant in the room, shall we? Needles. I mean, these procedures can cause a ton of anxiety for everyone involved. The child, the parents, and yeah, even the healthcare provider. So the big question is, how do we turn this moment of fear into a moment of trust? This right here. This has to be our #1 goal, period. Before we even think about the specific technique, our entire focus, our commitment has to be on actively reducing the fear and the pain that comes with needles. Every single choice we make from here on out serves that one purpose. So how do we do that? Well, here's your practical toolkit. Just planning ahead with a topical numbing cream can make a world of difference. And using what we call therapeutic hugging. It's not about restraint, it's about providing security while keeping the child safe and still. And please never, ever underestimate the power of distraction. A simple phone game or some bubbles can completely shift a child's entire focus.
This chart is super helpful. It basically breaks down the where and how much for intramuscular injections. You'll notice for infants, the vastus lateralis, that big thigh muscle, is the go-to site because it's the most developed and safest spot for them. And those volume limits are absolutely critical. They make sure the medication gets absorbed right without damaging or overwhelming the muscle. This isn't just a guideline, it's a critical safety standard.
You know, Getting an IV successfully is about so much more than just the technical skill of finding a vein. It's about creating an environment that feels less threatening. That means keeping the child's bed as a safe zone and doing the procedure somewhere else. It means using neutral language, no sticks or bee stings. And it means having the wisdom to know when to stop and think about an alternative, like a PICC line, to avoid the trauma of trying over and over again.
Okay, let's bring it all home. Let's circle back to this central idea, the core philosophy, that takes what we do from just a series of tasks to a truly therapeutic interaction.
This right here, this is the ultimate takeaway. Every single time you give a medication, it's an opportunity. You can either erode trust or you can build it. Your actions, your words, your preparation, all of it can leave a lasting impression that literally shapes how a child sees healthcare for the rest of their life.
So that is the question I want to leave you with, because answering it with preparation, with compassion, and with creativity, well, that's not just good practice. That is the true art of pediatric care.